with that, I'm very, very excited to introduce the Director of Medicaid Eligibility and Benefits, Andrea Emerson. So I'll pass it over to Andrea on that.
Thank you. Hello, everybody. Thank you for having me today. I'm really excited to be here. As she said, my name is Andrea Emerson. I'm the Director of Medicaid Eligibility and Benefits for CCA. So I support care management at both CCOs, LifePlan, and ACA with complex benefit and entitlement situations. Today, I'll be presenting on some common misconceptions that I've seen recently and over the years. So hopefully we can clear up some confusion pertaining to certain programs and the rules that accompany them. Thank you. If you want to go to the first slide. Our first slide here is the misconception being for kids under the age of 18, parents do not need to provide income information to Medicaid. So particularly for kids who are participating in the home and community-based waiver, that acronym is HCBS, Medicaid allows the parent's income to be waived that would otherwise make the child ineligible for Medicaid. It's very important for parents to know that even if their income is not being counted, they still must provide the information to Medicaid, both at application and recertification. This is a requirement by the state, and Medicaid's required to have that income information on file in the event that they're audited. As we know, during the public health emergency and even the unwind, this rule wasn't always enforced, but this is not a change. This has always been the requirement. HCBS waiver enrollment does not allow someone to choose not to provide the information. It just waives the income from impacting their eligibility. Next slide. The next slide is with the misconception that Medicaid and Social Security do not count the value of my trust, so I do not need to provide them with proof of my trust. So much like the last slide, even though the value of the trust and or the ABLE account is not counted towards the resource limit for needs-based benefits, proof that the account exists still needs to be submitted during those periodic reviews, both to Medicaid and Social Security. They have to approve the trust internally, and there needs to be specific language throughout the trust that states that the value of the account should not be considered for government assistance programs such as Medicaid and Social Security. And then it should also indicate what will happen to the remaining funds upon death of the beneficiary. They need to know the value of the trust as well, so they know how much to disregard towards the countable resource limit. Next slide. Thank you. So this misconception is that Social Security Disability Insurance, SSDI, and Disabled Adult Child Benefits, or DAC, are the same as Supplemental Security Income, or SSI. So this is not the case. Although they are all offered through the Social Security Administration, they differ in many ways, so I thought that we could compare them. In the first column, you'll have SSDI and DAC. Those are both referred to as Title II benefits, which are earned benefits, much like retirement and survivor benefits. Where SSI, Supplemental Security Income, is referred to as the Title 16 program, which is a needs-based benefit. If you're on SSDI or DAC, you automatically qualify for Medicare after 24 months of your established onset date. So that just basically means after you've been receiving the benefit for 24 months, you become eligible for Medicare automatically. The established onset date is the date that Social Security determines that your disabling condition prevented you from working substantially. With SSI, you automatically become eligible for Medicaid, which means that you no longer have to submit an annual recertification, and the coverage is automatically renewed each year as long as the SSI remains in pay. And in pay just means that you're receiving some type of cash benefit from SSI. Even if it's only $20 a month, that's going to keep the Medicaid active. For people on SSDI and DAC, everybody earns different benefit amounts because the benefit is based on earnings. For SSDI, the benefit is based on their own work history, and for DAC, the benefit is based on their parents' work history. For SSI, the benefit amount is capped each year. In 2025, no one can earn more than $967 a month in federal funds. This amount can be reduced by other sources of income or someone's living arrangement, but if someone's receiving $967 a month, that's an indication that they're on SSI. SSDI and DAC are both considered earned benefits because they're based on someone's work history, either their own or a parent's, and they paid enough in FICA taxes to be insured for these programs. Where SSI is considered a needs-based benefit and is available for people who were not given the opportunity to work, such as children, or people who just didn't work enough. So now let's talk about the resource limits for these programs. For people collecting SSDI or DAC, although Social Security does not impose a resource limit, since we're all on OPWDD services and also on Medicaid, then you must adhere to Medicaid's resource limit each year, which is a little over 32,000 this year. It's 32,396. I also wanted to mention that if you participate in the DAC budgeting program through Medicaid, in order to avoid paying a spend down, which we'll go over a little later, you have to keep your resources below $2,000. And for SSI, unfortunately, the resource limit is the same as it has been for about 30 years, which is $2,000 for an individual and $3,000 for a couple. Next, for people who are working and collecting SSDI or DAC, their income limit for earned wages is SGA, Substantial Gainful Activity. Every year, the value of SGA changes. In 2025, it's $1,620 for someone who is not blind and $2,700 for someone who is blind. For SSI, if someone is working, there's a formula that Social Security uses in order to determine the amount of countable wages. Social Security excludes more than half of someone's gross wages before it impacts the benefit amount. In 2025, the break-even point, or the BEP, is 2019, which means that after Social Security applies that formula, if someone is grossing $2,019 a month in wages, this will result in a $0 cash benefit for SSI. So that gives you an idea of how much someone can earn before it makes them ineligible for SSI. And then that last bullet we already talked about, so we can go to the next slide. Thank you. So the next one is a big misconception, that if I work, I will lose my Social Security benefits and my insurance. So I do want to say, although it is possible, there are many work incentives available that can be applied to reduce someone's income before it makes them ineligible for benefits and insurance. To know exactly how it will impact your benefit, first identify which program you're collecting from, because wages are counted slightly differently between the programs.
Oh, I just want to ask everyone to just mute themselves during the presentation if possible.
Again, leave it out.
I guess I'll have to wait till.
We definitely recommend that you meet with a benefit specialist to develop a plan so you know what to expect if you're currently working or thinking about going back to work. There are disability resource coordinators available and certified work incentive practitioners that can help you with this. We do have this support available at LifePlan, so if you are thinking about going back to work or already working and you want to explore the presence of work incentives, please reach out to your care manager and they can reach out to me and my team and we can help you through that. Next slide. So going along with the misconception that if you work, you'll lose your Social Security benefits, I wanted to specifically go over how work impacts SSI, Supplemental Security Income. Because SSI is needs-based, any other source of income will likely reduce the amount of your benefit, and different income is counted different ways. For SSI, like we said, Social Security uses a formula to determine the amount of someone's countable wages. If someone wants to work, the program really is designed to give people the incentive to try. You'll always end up with more money at the end of the month between your benefit and wages than you would if you were only collecting the benefit. And this is because Social Security excludes more than half of your wages before it impacts your benefit. And remember, if you're working and your earnings have reduced your SSI, even if it's only $20, $30, $40 a month you're getting in SSI, as long as you're receiving some type of funds from SSI, your Medicaid will remain automatically active, which prevents you from needing to submit an annual recertification packet. Next slide. So here we'll go through an example of someone who is on SSI and working, so you can see the total financial benefit. So if someone's working and grossing $1,300 a month, after SSI applies that formula, only roughly $600 of the $1,300 is countable, and someone would still be eligible for approximately $350 a month in SSI. Therefore, when you add their gross wages plus the SSI, the total financial benefit is almost $700 more each month than it would be if they were only collecting the maximum SSI benefit that's available. Next slide. So what happens to Medicaid if I lose SSI due to work? So going along with the same misconception that if you work, you'll lose your benefits, this slide shows how someone can maintain their Medicaid and subsequent OPWDD services, even if they lose SSI because of the amount of their wages. There's a program available called the 1619B program. This is a work incentive that's available to SSI beneficiaries only. People are eligible if the only reason they lost SSI is because of earned wages. If they maintain eligibility in all other areas, including being below that $2,000 resource limit, then they could qualify for 1619B and keep their Medicaid. There is an overall income limit for this program. The wages can exceed roughly $64,000 annually, and they must continue to meet the medical criteria. There's another program available for people who are working in order to maintain Medicaid called the Medicaid buy-in for working people with disabilities. So that's kind of a mouthful. So Medicaid buy-in for working people with disabilities, and that acronym is MBI-WPD. Through this program, people can exceed the traditional Medicaid income limit, avoid paying a spend down, and maintain eligibility. And there was a question sent in ahead of time for today's webinar pertaining to this topic, so I do want to explain the buy-in program and the spend down program quickly. When someone says Medicaid buy-in, I perceive that to mean the MBI-WPD program, which is offered by Medicaid, allows people to work and earn up to roughly $75,000 a year in 2025, while maintaining coverage and avoiding a spend down. You would apply for this program at your local Medicaid office, and they'll send you an application. A spend down is the difference between someone's income and the allowable Medicaid income limit. So I'll say that again. A spend down is the difference between someone's income and whatever Medicaid allows for the income limit to be that year. For people living in the community, this year the income limit is $1,800 a month. Anything over that becomes someone's excess income. They can still be eligible for Medicaid if they spend down that money by either paying it back to Medicaid directly each month, or they can submit medical bills or expenses that are greater than or equal to that amount in order to satisfy the spend down and have active coverage. Other ways to avoid a Medicaid spend down include setting up a supplemental needs trust or a pool trust. In these situations, Medicaid would need to approve it, but you could pay the spend down amount directly into the trust each month rather than paying it back to Medicaid, and you could use those funds for your own benefit. Another way to participate is by enrolling in the DAC budgeting program through Medicaid. And we mentioned this in the SSDI and SSI comparison. This program, the DAC budgeting program through Medicaid, used to be pretty popular because DAC benefits, remember, are based on earnings. So they tend to be higher than what SSI can offer, which usually results in people being over the income limit and incurring a Medicaid spend down. If you're enrolled in this program, Medicaid allows someone to avoid paying a spend down, but there's specific criteria. So not all DAC beneficiaries through Social Security get approved for the budgeting program. There's specific criteria, one of which being you have to have started on SSI and transitioned over to DAC when the parent fell into one of those three qualifying categories. The parents either passed away, started receiving Social Security disability themselves, or started receiving retirement. The incentive for this program is that people can avoid paying a spend down, but they have to keep their resources below $2,000. And ever since Medicaid increased the resource limit so significantly over the last few years, I would say that this program isn't as popular. Depending on whether or not you want to enroll really depends on how much the spend down would be for you and what your personal financial preference is. Some people would much rather pay $200 a month to satisfy the spend down in order to be able to accumulate resources that are over $32,000 compared to $2,000, because the resource limit for Medicaid is roughly $32,000. If you are on SSI or DAC budgeting and you have that $2,000 resource limit, please know that there are options available to protect resources, such as an ABLE account or a trust. Next slide. So next we'll go through how work impacts Title II benefits, such as Social Security disability insurance or disabled adult child benefits. Some people also refer to the DAC program as Childhood Disability Benefits, or CDB. It's the same program. It's a little more cut and dry for people on these programs because they just have to keep their earnings below substantial gainful activity, or SGA, which you can see here is valued at $1,620 per month for people who are not blind and $2,700 a month for people who are blind. And next we'll go over an example so I can show you the financial. Okay. So if you have somebody who gets $1,300 a month in DAC benefits off their late father, and they started working and they're grossing $1,500 a month in wages. Since $1,500 is below $1,620 and they're earning below the SGA limit, they can continue to work in the same capacity and collect their entire DAC check. So the total financial benefit here would be $2,800 a month, which we know is well over the Medicaid income limit. So that would be a situation where you would inquire about the MBI WPD program at your local Medicaid office. But unlike SSI, as long as you keep your earnings below SGA, you can continue to collect your entire Title II benefit plus your net wages. Next slide. Now we'll go over what are work incentives. So work incentives are ways to reduce countable income for people who are working. Countable income is the portion of income that remains after work incentives are applied. There are several different kinds of work incentives available, such as impairment-related work expenses, or IRWEs, blind work expenses, or BWEs, and subsidies or special conditions. Next slide. Impairment-related work expenses and blind work expenses are incurred out-of-pocket expenses that are necessary to work, related to the worker's disability, and paid for by the worker. The value of these expenses is deducted from their wages in order to reduce the amount of their countable income. Some common examples are transportation receipts, the cost of service animals, medical equipment that's needed in order to work, or the cost of attendant care. There is an exhaustive list on Social Security's website, which goes into greater detail, so that's a wonderful resource on ssa.gov. The presence of IRWIs can keep someone in pay, which will keep Medicaid automatically active if someone's on SSI. Next slide. Another work incentive that's available is the trial work period, or TWP, which is specifically for people who are on Title II. This program allows someone to exceed SGA without penalty by maintaining their Social Security benefit for 9 months. Social Security benefits are paid during the trial work period regardless of how much somebody earns. The 9-month period does not need to be consecutive, but must be within a 5-year time frame. While participating in this program, if you earn over $1,160 in any given month, that will count as one of your TWP months. No other work incentives can be used during this time, so it really gives someone the opportunity to see if they can sustain work at a certain capacity long term without jeopardizing their benefit. Next slide. Report, report, report. So with everything that we've talked about so far, the most important thing is maintaining communication with Social Security and Medicaid. Regardless of which program you're collecting from, at Social Security, you must report your wages each and every month. So whether you're on SSI, SSDI, or DAC, you must report your wages every month to Social Security. And talk to the claims representatives about work incentives, the type of work environment you're in, so they can explore the presence of a possible work incentive that you may not know exists. Some things to keep in mind. If it takes you longer to work or longer to do certain responsibilities than your coworkers, or you're earning more than the value of your work, that would be an indication that a subsidy or special condition may apply, and you can call Social Security. They'll reach out to your manager at work, and there's a form that they can fill out so that Social Security can determine what the value of that is and reduce that from your wages every month to reduce your income. Reporting prevents people from being overpaid. And I say this because, especially for people who are working, Social Security places an estimate on your record before they receive the actual stubs of what was actually earned in that month. And so that estimate, even if it's too high, protects you from being overpaid, because once they verify the wages, if they owe you money, they'll send that out at that time. But you don't want to get into a situation where the estimate is too low and they pay you based on the estimate, and then you are in a situation where you're overpaid. So you must report your wages every month, and you must report any changes in income or resources to them. Next slide. The next misconception is that Medicare health insurance and Medicaid health insurance are the same. So I thought we could go through and compare them. First, we'll go through Medicare in the first column. People become automatically eligible for Medicare through their disability benefit. If they're on SSDI or DAC, you have to be on Title II, and you become automatically eligible after 24 months. Where with Medicaid, you become automatically eligible through your SSI benefit or Title 16 program. We said there's a 24-month waiting period associated with Medicare, but there is no waiting period associated with Medicaid. There is a cost associated with Medicare. The Part B premium in 2025 is $185 a month. There is assistance available with that through the Medicare Savings Program or the MSP program. It's income-based, so if your income is below a certain amount, you could have the state pay that Part B premium for you, and you would ask about the Medicare Savings Program at your local Medicaid office to explore eligibility. Where Medicaid is free unless you're over the income limit and you incur a spend down. For Medicare, there's no income or resource limit imposed by the federal government. For Medicaid, there is both an income and resource limit. The income limit for 2025 for someone living in the community is $1,800, and the resource limit is $32,396. Medicare is 100% federally funded, where Medicaid is federal and state funded. Medicare cards are red, white, and blue, and they're cardboard, and they are mailed to you, where Medicaid cards are blue, yellow, and white, and they're laminated. And you would also use that card if you're on SNAP for food purchases. If somebody has both Medicare and Medicaid, the Medicare becomes their primary insurance and Medicaid becomes secondary, which roughly translates to Medicare covering 80% of items and Medicaid covering the remaining 20%. If you have any questions about Medicare, you can call your local Social Security office or Medicare directly. If you have any questions about Medicaid, you would contact your local Medicaid office or Department of Social Services. And Medicare does not pay for any of our services, where Medicaid pays for all of our services. Next slide. This misconception is becoming eligible for Medicare ends Medicaid. So I've gotten a lot of questions about this lately, so I just wanted to explicitly state that once somebody becomes eligible for Medicare, their Medicaid does not end. Medicare then becomes their primary insurance, and Medicaid becomes their secondary insurance. People receiving OPWDD services can have both. And there's no impact on their waiver services if they become eligible for Medicare, and that becomes their primary insurance. Like we said, there is help available to pay for that Part B premium, which is $185 in 2025 through the Medicare Savings Program. And you would ask about eligibility for that program through your local Medicaid office. If somebody refuses Medicare Part B when they first become eligible, people should know that there is a penalty fee imposed if and when they need coverage later in life. The penalty fee is 10% of the premium for each year that they refused coverage. And that's not a one-time fee. That becomes their new premium amount. So it can be very costly. So make sure that you're talking to Social Security if that's something that you want to do, so they can explain that further to you. This misconception pertains to SNAP, Supplemental Nutrition Assistance Program. The misconception is that if I live at home with my parents, I'm not eligible for SNAP. So federal regulations indicate that anyone under the age of 22 who lives at home with their parents will have their parents' income considered for eligibility purposes, even if they pay rent. Therefore, people can apply as a separate household and not have their parents' income count at age 22. People who receive SNAP and are on Medicaid use their Medicaid card for food purchases using SNAP benefits. SNAP will not cover hygiene items such as toilet paper, toothbrushes, shampoo, or feminine hygiene products. Next slide. This misconception is someone's moving at the end of the month and they need to notify Medicaid and Social Security now. Although you can do that, unfortunately, they will not make the change in their system until after the move has taken place. So it does make it a little challenging to be proactive in these situations. But if you're on SSI, you would notify your new local Social Security field office as soon as possible. There's a Social Security field office locator on Social Security's website, and you put in your new zip code, and you would contact them and let them know that you moved, when you moved, what your new address is, who you're living with, so they can make sure they're accurately paying your benefit out. And if your Medicaid is attached to that, then that will change automatically once Social Security processes it. If you're on Title II, you would call your new Social Security office and your new Medicaid office. If you're on Medicare, you would contact them directly. And if you're on SNAP, it's always a good idea to call your local Department of Social Services just to make sure that they've been informed of the change. Usually they share systems with Medicaid, but it's not a bad idea just to make sure everybody knows. Thank you.